Hi, I'm Femi Okay, and you're in the stream. Most people in Haiti lack access to adequate healthcare. So what can be done to resuscitate the country's medical system? To join the conversation, it's really easy. You can tweet us at ajstream or jump into our live YouTube chat, and you'll also be in the stream. It has been 10 years since a massive earthquake struck Haiti, killing hundreds of thousands of people and leaving more than 1 million homeless. The quake all but destroyed the country's healthcare system. A decade later, it remains in ruins, with an estimated 40% of the population still lacking access to care. Dr. Meline Denis with the charity Hope for Haiti shares one reason why.
Imagine a state hospital. In order to receive care, they send you away to go purchase medical supplies. That means a person can come in with an emergency and without anyone, and they won't be able to receive help. The hospital doesn't have the supplies available to help the person. That's the biggest problem we have in the healthcare system in Haiti. The state doesn't provide the materials for you, if you're a doctor, to care for the patients in the way you're supposed to.
Joining us to talk about Haiti's healthcare system, in Port-au-Prince, Sandra Lamarck. She's head of mission to Haiti for Doctors Without Borders. Also in Port-au-Prince, Franck Junus. He's the president of Private Hospital Association of Haiti. And in Fond-de-Blanc, Inobert Pierre. He's a doctor and director general for Haiti operations at St. Boniface Hospital. Hello, everybody. It's good to have you here. I am thinking back 10 years ago. Franck, this is what you look like. I'm just going to show everybody what you looked like back then. And you were chatting and you were talking about the emergency situation. What do you remember about the earthquake? What is the searing memory for you in Haiti about that earthquake 10 years ago? Franck, go ahead.
Yes. Hello, good morning, everybody.
Yeah, hello. What do you remember, Franck? We see you here. There's tents behind you. There's an emergency situation. What do you remember? What's the searing memory you remember?
It was basically a nightmare for every single Asian family living in the metropolitan area. I can tell you that at that time I was just hired by Care Haiti to become the health officer, the head of the health program for Care Haiti at that time, and it was my first mission trip. I was in Gonaive when the earthquake hit the country, and for 26 hours I was unable to talk with my family, and this was something that was the first time I had to live this kind of things, and I did not know whether or not my wife, my kids passed away because of that earthquake. And this is pretty much what almost everybody else remember from these 10 years, the fact that people living in Port-au-Prince was in great despair. People living outside of Port-au-Prince has a lot of questions that was unanswered, and it was very stressful.
So, Inobert, you went from an emergency crisis situation 10 years ago to a healthcare system today, which is what? How would you describe Haiti today in terms of healthcare?
I believe I can say that since the happening.
Franck, I'm going to share that question because we have a few other people in the conversation. You can stand by for a moment. I'm going to ask this to Inobert. Inobert, go ahead.
Okay. So
yes. So as you.
Inobert, go ahead.
Yes. So as you put it, Frank, actually, much of our health infrastructures were destroyed during the earthquake, and later, actually, not much has and actually the population has been growing since then, and we have more and more people with a very vulnerable situation showing up to our doors on a daily basis. So the challenges, I can say, 10 years later, are more than before the earthquake, because the earthquake has sort of fragilized our system, why the needs have increased.
Let me just bring Sandra into the conversation. This is an idea that, looking at this decade since the earthquake, the Médecins Sans Frontières, Doctors Without Borders have already been thinking about. I'm looking here at the report, Haiti 10 years on, and then looking at the healthcare system, actually even does it hold up as a healthcare system? Sandra, what can you tell us about what's happening right now in Haiti? If you're sick, how do you get treated?
Yes, that's a good question. Access to healthcare is a daily struggle for the patients we meet. I can maybe share some examples that may illustrate the situation better than statistics. Last Tuesday, so it's less than a week ago, we received a pregnant mother in a small health center that we support in the south of the country, in the department of the Sud. And there was a complication for this woman. So we had to refer her to a public hospital located 2 hours away, which we did. And so we arrived in this referral hospital at 8 a.m. And everyone tells us on the ground that it's okay, they will take care of her. So we leave. And she had to wait for over 14 hours before being operated on. So we got a call in the evening from the caretaker of the patient telling us that nothing had been done for her. So we had to give a couple of phone calls to really, I would say, agitate our network and make sure that she would receive some care. And she was operated on at 10:30 p.m. In other instances, we receive patients in this small facility that we refer to public hospitals, but they ask us to bring the oxygen. They ask us to bring 4 up to 6 caretakers to donate blood because they don't have blood available. And as the previous reportage that you just showed mentioned, in many hospitals, patients and caretakers need to purchase the glove, bandages, and simple medical supplies themselves in private pharmacies outside of the hospitals if they want to have a chance of being taken care of.
This is so important. And I'm wondering, Frank, this idea of having to bring your own medical supplies to be treated, was this the case before the earthquake? Is it worse now? Where does the earthquake fit into this situation where if you don't go to the clinic or the hospital with your meds, they're going to have a really difficult time trying to treat you? Frank, weigh in.
When it comes to the General Hospital, for instance, and many other public institutions, the situation became, I can say, became worse in terms of what the population needs to invest to receive care. Year after year, the contribution of the household is becoming greater in the healthcare system. So right now, what you have about 1/3 of the investment in healthcare facility that comes from the households, and the government is investing very little for servicing the patient. What you need to understand is that when you take the public services, the public hospitals, what you can see even though the hospitals are here, physically present, you are not certain that the services are available.
Yes, Frank, I'm so glad you said that, because we're looking at pictures of hospitals and I'm seeing equipment that I would expect to see in most hospitals anywhere. But what's the but?
I can tell you even more than that.
Yeah.
Myself and Dr. Inover, we just said that the situation is getting worse. But when you look at the data, you can see that from 2010, there have been additional health facilities that the government was built. You can also see that there are many other actions that was taken in the healthcare system. Many things have been done, and including meetings, including institution that was built and equipped. But when it comes to turn them into operational institution, you do not have results from what you have.
Why? Let me Frank, hold tight for a moment. Let me just ask Inabé, why? There's a new hospital in Port-au-Prince. Is it finished yet, Inabé?
No, actually, it's not finished
yet. How long does it take to finish a hospital?
Yeah, it depends on the magnitude, the complexity of what you're building, but that building was so it was forecast to be finished last year actually in 2018. It started in 2014. So basically 2 years on completion.
Right.
So it's still there, and it could absorb a lot of needs for the metropolitan area.
Yeah.
But so far, like centers like St. Boniface in the South, are all doing the work that.
In a bear, I'm so sorry. You're cutting in and out, and people have to appreciate that in Haiti, connectivity is not always smooth. So apologies about that, in a bear. We're just going to jump out of you just for a moment. Sandra, when I asked why the General Hospital in Port-au-Prince was not finished, you smiled slightly. It was a very knowing smile. What was going on there? What were you thinking?
I was thinking that, of course, it's a pity that the construction is not finished, but beyond the construction, there has been a lot of focus on rebuilding the infrastructure after the earthquake, which was obviously highly needed, but it's the top of the iceberg. If you don't have money and qualified staff to run these hospitals and these facilities, it's not going to work. So what is really, I think, painful to observe is that maybe 15 years ago, in 2006, the part of the national budget that was dedicated to healthcare was over 16% of the national budget. And today, it's only 4 or 4.5% of the national budget dedicated to healthcare. Health is not prioritized enough by the government. It's underfunded. And so even if we finish the construction of the General Hospital, which nobody really knows when this will happen, you will still have problems to make sure that someone can actually run this facility.
I'm just wondering, Frank, as people watching this thinking, there was such a huge response to Haiti's earthquake. There was so much money being pumped into Haiti. Why are you not the Switzerland of healthcare right now? Because there was so much money coming to Haiti. That initial year, 2 years after the earthquake, people around the world wanted to help you. What happened?
Okay, the first thing you need to remember that most of this money did not necessarily go into the healthcare system, into the health system as a whole. You had a very, very large part of this money that went directly to NGOs. And when I'm talking about NGOs, I'm not even talking about large responsible NGOs, just like Doctors Without Borders. You had a lot of this money that was used by people that we can call volunteers on the field, and we're talking about, I believe, at the first year it was around $2 billion that the ICAT received in terms of donation. Altogether, but we know that very little as 1 or 2%. Came to the system. So it was not very much money that it was helping to build back our health system. We tried to actually have a plan. The country tried to have a plan by 2012, and it is not before 2013, 2015 that the country was able to release a formal document as a national health policy. So this money came along, but we cannot say that the use of this money was right in terms of rebuilding the health system.
In a bear, how do you practice medicine under this kind of situation? If you have a limited amount of medicine, the patients are bringing their own, you don't have the right amount of funding, how do you even practice medicine?
Yeah, I work in a private hospital. We're working in the South. So our management system is a bit different than the public hospitals. So we've been around for more than 30 years providing healthcare to the most vulnerable in the Southern Peninsula of Haiti. So actually, we've been overwhelmed year after year with patients, inundated basically with patients coming from the Port-au-Prince area and all the way between Port-au-Prince and Fond-des-Blancs in the south, because all around us there's no major facilities who could absorb part of the work that we do. So we really strive to do the most that we can in a very difficult environment, because we need to address problems that should be addressed by other facilities.
How do you mean that? We strive to do the best we can do. Give me an example of you striving every day.
Yeah, for example, every day we are 120-bed hospitals, but we've been seeing about 1,000 patients every day. And the access to our hospital, because we are working in a very rural area, we don't have like a good road to our hospital. And many people show up on a daily basis to our doors, but we can't basically turn any patient away, because we know that if we turn patients away, they wouldn't have access to the basic care that they need. So we need to do more than we should, because access and options are very limited.
Let me share some of the conversations, Sandra, with you and Inabert and Franck as well, that's been happening on YouTube. And there's been a back and forth about who is responsible. Emre says all of what the guests are talking about boils down to a failure of governance. What we haven't talked about are the protests. The protests have been bubbling up over the last couple of years. And some of it is about corruption. Some of it is about we just don't have enough money to live. And the health of the public, of course, is very, very important in all of that. Sandra, I don't want you to take a political position, but governance, is the governance the difference between Haiti succeeding right now and failing in terms of healthcare?
Yes, you're right. Governance is definitely part of it. But also, maybe if I can go back a little bit, we all need to remember that in 2010, we estimate that 60% of the health system and the health facilities were destroyed. So the reconstruction would have been a huge effort anywhere else. And to add to this, the problem is that we also had successive healthcare emergencies in the country. We had the cholera epidemic in the same year, in 2010, that also, I would say, took a lot of effort for the already damaged health system to be able to cope with this. And then there was the hurricane Matthew, and then more recently, the political and social situation that you are describing. I mean, not commenting on the reason for the demonstrations, which we understand perfectly, but the problem with the strategy that was adopted, especially at the end of 2019, the Pays Loc, is that when you have barricades everywhere, it makes things worse for access to healthcare, because patients cannot move out, cannot go to the health facilities. Health facilities themselves have not been able to receive fuel to make sure they can run the OT. They were not able to receive oxygen, basic supplies, blood. So this created a lot of problem for the population, not to mention that some healthcare facilities were attacked. The General Referral Hospital for the Department of the South was attacked and looted twice. The blood bank of the South Department was also looted, and today, we're in January 2020, it remains closed. So the only way I actually really appreciate what Dr. Pierre said, because we work in a small village in the south, which is located 5 hours away to the Saint Boniface Hospital. But very frequently and more, we need to drive these 5 hours to get to Saint Boniface Hospital, which should not be our referral hospital. I mean, there are 4, 5, 6 different hospitals between Port-à-Piment, where we work, and the Saint Boniface Hospital. The Saint Boniface is the only one being able to operate with quality of care, and as Dr. Pierre said, they accept everyone. So I'm really grateful for the work you're doing, and I mean, I wish there were more hospitals such as yours.
So guess.
Let me add something to that.
Yeah, go ahead, Franck. And then I want to bring in some other comments, because people are watching you and they're wanting to ask you questions. So be brief so that I can get to their questions. They want to talk to you. Go ahead. Okay.
Let me just add to that. That one very important point to make about the healthcare system is, as you said, the governance of the system in its entirety. I believe one of the main problem of Haiti in terms of healthcare, and this is not just for healthcare, probably it's for everything when it comes to social services. It's the leadership in general of the country, but also the leadership of the sector. Actually, the healthcare system is healthcare services. This is just 1/3 of the services that are provided by the public
Frank,
sector.
I'm going to push you. I'm going to push you because we spent way too much of this program talking about all of the problems of Haiti and not enough talking about how to solve them, which is probably the issue with Haiti anyway. Too many problems and not enough solutions. Let me bring in Claudine Francois. She's a community health program coordinator. She is thinking about Haitian solutions for Haitian issues. Have a listen to her.
People who live in these communities find it very difficult to find health care when they are sick. For this reason, in our program work, we have mobile clinics where we travel to find people in these communities so we provide health care. Also, we have community health workers in these zones who work with children in schools, where they do sanitation education with the children, and they have first aid kits, so when they are sick, they can have access to first aid. And we train the community health workers on the medications and materials so they are ready to provide first aid, so when people are sick, they can find first aid in the meantime before they go to the hospital.
So, guys, I'm going to push you. I'm going to call this the speed round. I want an instant reaction to this. Frank, you start. So, if you're looking for unique solutions to the healthcare issues of Haitians, name one. Name one.
Okay, that's fantastic because I had 3 proposals that I put on my note to share with you about the
Tell me the one you care most about. Go for it.
One.
Yeah, go on.
I wanted to touch. It was the community health. And when I talk about community health, I would like to remind the fact that in 2016, when they released the last national policy for health.
Frank, remember, this is the speed round. Make it quick. So, have you finished with that point?
Okay. So
yes, good.
Community health was considered the backbone of the new healthcare system that they don't want them to put in place.
All right.
And they
community healthcare. Frank, I want to share this with your colleagues. In Aubert, immediate solution that you know from the work that you've done. What is it for healthcare? How do you help? How do you advance it in Haiti?
Yes, I think we need to build a system. We have doctors, we have health infrastructures, we have nurses, we have many things, but we don't have a system yet. So we need to build a system with
obvious.
Yes.
When you say it's so obvious, is it even possible though? How do you build a system from scratch?
So I think first we need to outline it and then make sure that we identify the key players and with responsibilities clearly defined and hold people accountable. Because right now,
building a system from the ground. All right, Inabeg, thank you so much. Sandra, I know you've had plenty of time to think. Instant answer though from now. That where do you and you've been in Haiti for a very long time, so you must obviously see how do we do this better. Name one thing. Go ahead.
Training, definitely training. And if I want to name one success story, it's actually in Mirbalais. There is a university hospital run by, in partnership, the government and Haitian American organization named Partners in Health. And they've just obtained last week, I think, international recognition and certification for the trainings they are providing. So this is a big success story, and we should all replicate more of this. And this is what also we try to do at Doctors Without Borders.
All right, thank you. Thank you to Inabeg, to Frank, and also to Sandra. I'm going to leave you on a comment here on YouTube. Faith says, is there something I can do to help the healthcare crisis in Haiti from here in America? Are there lobbies here in the States that we can put pressure on? Who should I donate to? We will jump into the live YouTube chat. It is curated. We are there as the stream team, and we will let you know about all of the guests, various different organizations, so that you can trust them to help Haitians with their healthcare. Guests, thank you very much. You've inspired our viewers. We will end the conversation there. I will see you next time on The Stream. Take care, everybody.